Alright, so this chapter is on harmonics and contrast agents, and I know I've given Dr. Edelman a lot of gruff over his book, but absolutely this chapter he's got it correct. So well, let's get into this here. So the fundamental and harmonic imaging, what we call fundamental imaging, is using the broadband frequencies around the center frequency that we've talked about with the quality factor and the fractional bandwidth, all of that. That's all fundamental imaging. Harmonic imaging is looking at frequencies that develop in the body. So here's what happens. The tissue sound, as it passes through the body, the propagation speed is slightly faster in compression than in rarefaction. So your cycles of compression are traveling slightly faster than the cycles of rarefaction. And this is a nonlinear behavior that occurs, and what happens is that the sound will then begin to develop harmonic distortions due to this effect. And the strongest distortion that occurs is at the second harmonic frequency. This is a frequency that is twice the fundamental frequency. So if we're scanning at 5 megahertz, the second harmonic frequency is 10 megahertz. Okay, that is where the fundamental frequency doubles. That is where the strongest effect of this harmonics occurs. It also occurs at 15 and 20 and other multiples in there, but it is strongest at the doubling, at the second harmonic frequency. So when we look at the wave distortion, when we have a pure tone that's occurring and it's moving about 1.54 kilometers per second, remember that's what we say our speed of sound is, 1.54 or 1540 meters per second, then the sound in compression, where the signal is everything is the highest pressure, is moving slightly faster than the sound in rarefaction, where it is moving slightly slower. And you end up with this changing of the sound wave so that you develop what we call a frequency. And if you want to think about it perhaps in another way, when we are looking at this sound wave, if this is our fundamental frequency, then you could imagine a doubled frequency developing that is following along this wave. Okay, so this steeper wave front here represents a doubled wave, a wave that is twice the fundamental frequency. So fundamental imaging is what we've been talking about up to this point. This is the image created by processing the same frequency that we transmitted. So whatever we transmit, that's what we're going to process, and that's what is going to give us our fundamental image. Harmonic frequency receives back the fundamental frequency, but that gets suppressed, and the only thing that gets processed are the harmonics, which are twice the fundamental frequency. Okay, so harmonic imaging doesn't turn on the harmonics so you get a doubling of the frequency. What it does is it takes out the fundamental, and the only thing left is the frequencies that have already been changed because of the action of the sound in the body. Alright, so turning on harmonics does not create harmonics, it just removes the fundamental frequency from the sound. Now, when we look at the strength of our signals, the fundamental frequency is significantly stronger than the harmonic signal. So we have to do some filtering to get rid of this, because it would overwhelm our harmonic signal. So let's take a second and talk about linear and nonlinear behavior. So linear behavior is proportional, and linear systems respond proportionally to signals. Okay, so if you send out twice the strength of amplitude of a signal, then a linear response would be twice the strength echo returning. Nonlinear responses are asymmetrical. They're irregular or disproportionate. So if we send out twice the strength signal, we may get back twice, we may get back 3 times, 4 times. Whatever we get back is going to be a disproportionate response to what we sent out. So mathematically, linear responses are proportional responses. Nonlinear responses have at least some component where there's an exponential change in the function. With linear responses, the slopes are always straight lines, hence the term linear. With nonlinear functions, they are never straight lines. They are always some kind of a curve. So now we can use that technology, linear and nonlinear terminology, to talk about how harmonics develop. Okay, so harmonics develop as the sound travels into the tissues. And so when you're in near field, when you're imaging in the near field, the sound hasn't traveled enough to create harmonics. Okay, so in the near field there's not harmonics available because they just haven't been developed. In the far field, harmonics were developed, but because they're at twice the frequency of the fundamental, they're all attenuated pretty much before they get back to the transducer. So in the midfield is where tissue harmonics will always be the strongest. So if you get a question like, okay, where is it best to image tissue harmonics? Well, the answer is going to be in the midfield. Okay. The nice thing is there's no distortion of the superficial layers. You know, if we get higher, because it's at a higher frequency, we get better spatial resolution. So harmonic imaging in a lot of ways is very good for us. How do we know if harmonics is useful for whatever we're imaging? It's very simple. Push your button on your machine that says harmonics. If the picture gets better, then harmonics are useful. If the picture gets worse, then harmonics are not useful. Push the button again and turn it off. Now here's one of the things I want to really emphasize, and that's beam strength versus harmonics. Okay, because harmonics are not a linear function, it requires a much stronger proportion of the signal to generate them. So within our beam, as you know, as you work across the beam, some areas have a higher intensity and some areas have a lower intensity, and that's known as your spatial spread or your spatial intensities. And we know that it is strongest in the center than it is on the outside. But harmonics are only created by strong beam signals, so they only appear in the center of the beam. Okay, so harmonics will only appear in the main axis of the beam. Okay, so this is going to give us a lot of benefits. This is going to give us better lateral resolution because our beam width is narrower with harmonics. This is going to eliminate a lot of the side lobe artifacts or grading lobe artifacts. Okay, and so overall, it gives you a narrower beam and higher frequency. So those are generally things that are really good to have. Okay. So let's look at the summary of tissue harmonics. And so tissue harmonics are not present when the pulse leaves the transducer. They're developed in the tissues during transmission by this nonlinear behavior, whereby the sound is moving faster in compression than in rarefaction. So if you got a question like, let's say, one for the SPI exam, what causes harmonics? Sound moves faster in compression than in rarefaction. There you go. I just gave you an SPI question. Harmonics, because of the nonlinear behavior and the fact that they need a stronger signal, are only created along the main axis of the beam, so you get a much narrower beam width because of them. They're not present in the near field because they haven't developed yet. They're best in the midfield, and they're attenuated if they are created in the far field. They don't have a chance to get back to the transducer due to the increased attenuation with frequency. So here's a couple of images that you can see how this this bladder looks. You can see this person has a very enlarged prostate. So fundamentally, we see a lot of reverberation artifact. We see some ghosting in here from probably from side lobe artifacts. Okay, and then if you look in the very far portion of the bladder, it's very difficult to tell if this is another reverberation artifact or if it is actual debris in the bladder. Okay, this person's also had a transurethral prostate resection. It's also known as a TURP procedure. You can see the wedge taken out of the prostate here. So when they turn on harmonics, we see less reverberation artifact. That's due to the shape and strength of the beam. We do see a little reverberation over here on the upper right of the screen and in the very center. But a lot of the reverberation on the left side is out. We're starting to see a lot of small specular reflectors in the fluid in the bladder. So this is because harmonics are a higher frequency and small reflectors act like Rayleigh scatterers, and Rayleigh scattering is proportional to the frequency to the fourth power. So when you're in your fundamental frequency, you don't see a lot of these, but when you turn it up and you're looking at the harmonic frequency, we see a lot more of the small Rayleigh scatterers because we're using harmonics. And then you can also see that in the distal portion of the bladder here that this actually is debris and not just a reverberation artifact. And it's much clearer where the TURP procedure occurred at on this patient. So let's talk about a couple of techniques that are used to enhance harmonics. Okay, and these are techniques that are actually, it's better to say they reduce the fundamental reflections or reduce the signal from the fundamental reflectors. So there's two main means of reducing the fundamental frequency. We can put in what's known as a low pass filter, so that low frequencies, relatively low frequencies, are eliminated, or you could say a high pass filter, so that the higher frequency harmonics are passed through. And then another way to reduce the fundamental frequency is something called pulse inversion. Okay, so what pulse inversion does is it cancels out the fundamental frequency. So what we do is we send out our pulse, we get back our fundamental and harmonics, and then we send out a second pulse that's inverted along the same scan line. The echoes from the second pulse are then added to the first. And if you recall from earlier discussion about interference, if you add two pulses together that are exact opposite copies of each other, they cancel each other out, right? That's destructive interference. And so all that remains from this is the harmonic frequencies. So let's take a look at those real quick. So we send out a pulse, okay, and we could call that this darker purple line here, and then we send out an inverted pulse along the same scan line, and when these come back, they cancel each other out, and the only thing left is the sum of the signal and the reflected signal, and that is what was generated by harmonics. So the fundamental frequencies will destructively interfere and cancel out, and the harmonics, because they're nonlinear, will not cancel, and so we don't get that cancellation of their signal because they were nonlinear. So the one main disadvantage of pulse inversion is that we have to send out two pulses in order to get a single scan line. But the pluses of harmonic imaging are we get decreased reverberation, decreased beam aberration, decreased side lobes, decreased beam width, so better lateral resolution, decreased haze, that fuzzy stuff at the top and the signal on that. Let's just go back to that picture. This would be called a haze artifact up here. We get decreased temporal resolution. That's a bad thing. We get improved axial, lateral, and contrast resolution. So our spatial resolution and our contrast resolution have improved. And with that also, it doesn't say here, but we also get improved elevational resolution because the beam is going to be narrower in the elevational line too. We get improved cystic clearing. And you get improved B-mode imaging of Rayleigh scatterers. So those are all good things. Let's see, Rayleigh, is that not spelled right? There we go. Not sure why scatterers wasn't right. Okay, so those are all the pluses of that with pulse inversion. Now there's another way we can improve harmonic imaging, and this is called power modulation. So power modulation utilizes a technique of modulating the power in order to create better harmonic signals that will come back. So what happens is two successive pulses are sent out. The second pulse has twice the strength of the first, okay? And because the first pulse is weaker, it does not generate harmonics. Remember, harmonics have to be generated by a strong pulse, okay? So in this case, the first pulse goes out, we don't get the generation of harmonics, but we only get harmonics from the second. So during reception, what we do is we amplify the first pulse, we double it to match the second pulse, and then we use the same subtraction technique that we had with the pulse inversion. So we double it, invert it, and then subtract it from the first pulse. And the result left are the nonlinear pulses that come back from the harmonics that were generated. Now, an interesting thing that is shown on this picture, which we haven't covered yet, is that in general, this pulse and power modulating harmonic imaging technique is used for contrast bubbles. Contrast bubbles produce very, very strong harmonic signals. Okay, so our tissue, if we have our tissue reflections coming back to us, these will be non-harmonic generally, because tissue doesn't generate harmonics as well as contrast bubbles. And then the signal we get back is from the contrast bubbles. So this is a technique often used as power modulation for imaging with contrast bubbles. Now let's talk about contrast bubbles. So contrast agents are little microbubbles that are injected into the bloodstream. These are gas bubbles that are encapsulated in a shell. So they usually use gas like nitrogen or something that isn't going to leak through the lipid shell of the contrast material. It goes in intravenously. Sometimes you can swallow it, but generally it goes in intravenously, and then it's small enough to pass through capillaries, so it goes from the veins into the lungs, back to the heart, and then out to the rest of the body. Okay, so it has to be, there's 5 requirements for contrast agents, and number 1 requirement is it has to be safe, needs to be metabolically inert, something that the body doesn't react with, fairly long lasting, be a strong reflector, and if it has gas in it, it's going to be a strong reflector, because as you know, gas is a strong reflector in and of itself, and small enough to pass through the capillaries, which means it has to be the size of a blood cell or smaller. In fact, smaller is better, because blood cells actually tend to fold as they go through capillaries, so contrast agents need to be quite a bit smaller than a blood cell. So contrast agents are able to create much stronger harmonics than tissues. Okay, and these contrast harmonics are generated during the reflection of the signal. So contrast bubbles will demonstrate a nonlinear behavior. These bubbles expand during rarefaction much more than they do during compression. Okay, so what this does is it sets up a resonance frequency, usually between 2 and 4 megahertz, depending on what your fundamental frequency is. With contrast material, the most important aspect of this is that the rarefaction, the strength of the rarefaction is much more important than the compression. Okay, because bubbles will tend to burst under rarefaction. They don't burst at all under compression. You can compress them a lot and they won't burst. This is the picture showing a liver just filled with tumor that shows up very well under contrast, but hardly at all under normal fundamental frequency imaging. So contrast agents, the amount of contrast harmonics is estimated by something we call the mechanical index. This is a number on your machine that tells you the propensity of bubbles to burst in the body. So the mechanical index increases with lower frequency and stronger power. Okay, so if you turn up your power, you get a higher mechanical index. If you lower your frequency, you get a higher mechanical index. Okay, and this should make some sense to you by lowering the frequency, because what happens is the bubbles are now spending more time, if you will, at rarefaction than they are at compression. Well, in a higher frequency, they're in rarefaction for a very short period of time compared to a lower frequency. So low frequency, they're in rarefaction for just longer time, and that gives the bubbles more chance to burst. Okay, so low MI, less than 0.1 MI, harmonics are not going to form. Even with contrast bubbles, they won't form. In mid mechanical index, so 0.1 to 1.0, you start getting small harmonics. And this is what we're going to start seeing as the sweet spot, 0.1 to 1.0 small harmonics. Below 0.2 is called very low mechanical index, and they utilize very low mechanical index imaging to look at tissues utilizing with contrast material in it. But that's a whole nother story. So the sweet spot for harmonics for contrast agents is 0.1 to 1.0. High MI is greater than 1.0, and this is where you're going to get bubble disruption occurring. The fact is, you get bubble disruption at any mechanical index above 0.3, but really at 1.0 it's really going to destroy the bubbles. So here's our mechanical index, and this is the formula for it. Peak rarefaction divided by the square root of the frequency. So it's a very straightforward calculation to how to get the mechanical index. Below 0.1 MI, no harmonics, we get some backscatter, just as you would with regular tissue. It's a very linear behavior at this point, so you're not getting harmonics because it's a linear behavior. The contrast agents behave linearly, and the bubbles expand very little. With our mid-range harmonics, we do get nonlinear behavior, thus harmonics, and the bubbles expand pretty much. And then anything above 1.0, you're going to get disruption of the bubbles. It will form very strong harmonics, but you'll also get big disruptions of the bubbles. Let's talk about contrast agents. The important characteristics that determine the contrast agent's stability and longevity in the bloodstream is what is its outer shell made of. Usually they're made of fat, lipid shells. And what is the gas that's inside of it. Okay, so the shell traps the gas, and generally what happens is it gets into the body, and then it will eventually dissolve. So if the gas in the shells is too small of an atom, then the molecule will leak out through the shell. If it's a larger molecule, then it can't leak out. And summarizing contrast agents, harmonics are generated by microbubbles, much more so than by regular tissue harmonics. So let's look at our summary of harmonics with contrast materials. The harmonics are created not in the propagation through the tissue, but during the reflection. The reflectors have nonlinear behavior. The resonancy creates some harmonics, and disruption of the contrast will create even greater harmonics. This action is all dependent upon the mechanical index, and so low mechanical index between 0 and 0.1 you get no harmonics. In the mid-range between, I'm going to say 0.1 to 0.3, we get some harmonics and the contrast doesn't burst. Above 0.3 we start seeing some bursting of the contrast material, and then at above 1 we see greater harmonics, but we see complete shell disruption. So this is all affected by whatever the microbubble shell is and the gas within it. So, summary: in tissue harmonics are created during the transmission of sound through the tissue, or a better term might be propagation of sound through the tissue. Contrast harmonics are created during the reflection off of the microbubbles. Tissue harmonics occur as sound propagates. Contrast harmonics occur only when contrast agents are present. Hopefully that makes sense. With a mechanical index greater than 0.1. Tissue harmonics result from nonlinear behaviors of the sound beam, and contrast harmonics result from nonlinear behaviors of microbubbles. And you get a very weak harmonic signal from tissue harmonics, but you get a very strong harmonic signal from contrast harmonics. So that's very good information to know. Alright, so we're going to stop there, and this is going to take us through the 7th of November. So good job, folks.